is LaCrista. LaCrista, girl, you're in trouble. You're in trouble, girl. Because all your information is floating all over the internet because of your behavior. You're supposed to be a nurse. You're supposed to care for people, have empathy, have consideration. And from the last 2 videos I seen, you didn't display that type of behavior towards people of color. The young man that had a seizure that came into the emergency room, and now the young lady that was in active labor.
Fuck! When's your due date? Ah, right now! Is your due date 11? Ah! What? How many times have you been pregnant? 3! This is your 3rd pregnancy? Yes! You have 2 babies at home? It's in my ass! You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Beverly, this is the first time I have a patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due date
I
is
just
the
said
10th.
it was the 10th. Her due date is the 10th.
She had 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors.
Look at that clip for a second. You have a black woman in active labor, tossing and turning in a transport chair, going from sitting to standing, even dropping down on her knees in that chair, trying to get comfortable because the pain is that intense. And the response she is getting is paperwork and "I cannot help." Childbirth is not a customer service issue. It is a serious medical event. If you drag your feet, if you miss the signs, that can get deadly very fast for both the mother and the baby. So here's what went down at Dallas Regional Medical Center in Mesquite, Texas. Cash, the mom, brings her daughter Carrie to the hospital. Her water had already broken. This is her 3rd baby, and she is clearly in excruciating pain. In the video, you can hear her say the baby is in my ass. And for anybody who has been through labor, especially on baby number 3, that usually means that baby is low and things are moving fast. According to Cash, they sat there like that for over 30 minutes, answering intake questions while her daughter is screaming, tossing, standing up out of the chair, dropping down again, and begging for help. Instead of wheeling her straight to a room to be checked, the nurse is focused on intake. How many pregnancies? How many kids? Who was your doctor? What is your due date? At one point, the nurse even forgets the due date and they have to shout it back to her through the pain. Carrie and her mom kept saying, "The baby is coming. She is about to give birth in his chair." Y'all treat all your patients like this or just the black ones? And the nurse, identified on social media as LaCrista Vaughn, hits them with, "Someone is coming to take you to labor and delivery. I cannot help." 30 minutes of that, y'all. Carrie finally gets taken back, and guess what? She delivers her son 12 minutes later. Not hours, but 12 minutes. And in follow-up posts, Cash says the baby had a bowel movement in utero and had to have multiple tests in the first 24 hours because of the stress of that birth.
Hey guys, I'm here with Mom and baby Cash. They are doing well. He has a doctor's appointment tomorrow at the pediatric center. It's a lot of concerns. They taking tests on him. He said have to go through several other tests down the line because he was born with his eyes open, and due to the stress and trauma that occurred in the triage area, the baby had a bowel movement in Mom, and that fluids was green, and like I said, he born with his eyes open. So they are, taking all that in consideration as well. He's eating well, sleeping well.
All of that after sitting in the lobby like she is an inconvenience. Now, what bothered me the most was not only what she said, it was how she said it. The nurse is cold, nonchalant, and moving with zero sense of urgency. No warmth, no compassion, no concern, no, let me see what I can do. Just as flat energy, like this woman crying out in pain, is a problem to be managed instead of a patient to be helped. When you become a nurse or a doctor, you take an oath. You do not take an oath to the hospital's billing system. You do not take an oath to your shift report. You take an oath to the patient in front of you. A woman in active labor, third baby, saying the baby is right there, screaming, trying to crawl out of the chair. This is not a let me finish these intake questions moment. That is an emergency. Paperwork can wait. Insurance information can wait. Her pain and that baby's safety cannot. In that moment, I cannot help was a choice, because maybe you are not anesthesia. Maybe you are not the L&D nurse. Cool. But you can still help by getting up, pushing that wheelchair yourself, calling upstairs saying she is crowning, she needs a bed now. You are not helpless. You chose to be disengaged. People online are saying that LaCrista has been fired. There are threads, TikToks, Facebook posts showing her name, her license number, people calling for her to be put on a do not hire list. Right now, Dallas Regional has not put out any official public stating that clearly says we fired this nurse. Their statement is the usual. They say that they care about safety, dignity, and compassionate care, and that they are reviewing what happened, but cannot share details because of privacy laws. So as far as I can see, the she has been fired story is coming from social media, not from the hospital itself. And I want to say this. If she did not get fired, that is a consequence, not full justice. Because firing one nurse after she goes viral and gets dragged is not the same as fixing a system that allowed her to look at a Black woman in obvious distress and decide, yeah, she can wait. Now, listen to what medical professionals are saying, because it's not just random people in the comments that are outraged. You have an OBGYN and multiple labor and delivery nurses on TikTok and Instagram saying the same thing. There is no excuse for letting someone sit like that in that level of pain for that long. A patient in visible active labor should be taken back immediately, not treated like a routine walk-in.
Who's your doctor?
Lang is her doctor.
Let's talk about this Dallas video, because it's not just bad behavior, it's dangerous, it's discriminatory, and it's why Black women in this country keep dying. The young woman's in active labor, and clinically we all know that priorities shift. Intake stops, and your eyes should be on that mom and the baby. But instead, we're watching a nurse sit there asking frivolous questions while a Black woman is clearly in distress, progressing, and not treated with the urgency and dignity that she deserves. It's not just rude, it's dangerous. It's egregious, and it's actually disgusting medical care. And I need y'all to understand something, that as a Black OBGYN, this is not an isolated incident. This is a culture. And this is what happens when a healthcare system that is not designed for anyone outside the majority, this is how it affects and shapes the legacy and how Black women are treated in real time. This is our maternal mortality numbers. This is how Black women end up ignored, undiagnosed, untreated, and unprotected. It's a bias, it's systematic, and it's behavior like this that gets passed down, normalized, excused. This is a culture problem in Dallas, Texas probably as a whole. And a culture doesn't change with a press release. It changes with accountability, retraining, leadership, consequences, and a refusal to let people like this touch patients. So in closing, Black women deserve urgency, compassion, and clinical excellence. This ain't it. What we saw was unacceptable, and it's time that the healthcare system finally stops pretending that this doesn't happen. You need to do better.
I just watched something that absolutely disgusted me. As a former ER nurse and a current labor and delivery nurse, I usually try to seek the best intent of a nurse. Not today. Because barring you having a medical emergency yourself, where your legs, your arms, and your voice no longer work, there is zero excuse for the blatant neglect that I just watched. And as a reminder, Black women are 3 times as likely to die in and around childbirth than their white counterpart. Part of that is because they are not believed about their pain. How you can sit there on the computer and act like you don't notice that this woman is actively birthing beside you is crazy town to me. Unacceptable, inexcusable. And if you've got coworkers who you watch do something like that, you are just as culpable.
What disturbs me are nurses in the comments saying, that's just protocol. That's scary. It is one thing for her to be following procedure, and it's another thing for her not to give a damn and show no compassion. And that is what she did. She was not looking like a nurse in that video. She wasn't trying to calm the woman. She didn't give a shit. Now, even if you try to spin that narrative that, oh, it just was protocol. She was just simply doing her job. Then there's another video that she was in going viral 2 years ago with millions of views where she was being rude and nasty. The same nurse, okay? Then where she seemed like she didn't give a damn, showing no care. Lightning don't strike twice in the same place. This is who you are. And then here comes the nurses that work with her in my inbox saying she's horrible. She's the charge nurse and is a bully. The ER director, McGraw, or whatever the name is, they won't do anything about it. She's that nurse that we always talk about, that bullier, that nurse that makes everybody else's job miserable, that's just a straight up no good nurse.
So this is not a case of, well, maybe that is just how it works. People who actually do this for a living are looking at that video and saying, absolutely not. This is not how you triage someone in that state. And then there is the reputation piece. Because in the mom's own words, she said it was not until they got upstairs to labor and delivery that they saw any real care or sympathy. Before that, she said they could care less and did not care whether her daughter gave birth in that wheelchair. You have locals in comments and on Facebook saying this hospital has been known for poor bedside manner and rough treatment, especially when it comes to Black patients. Some are calling the hospital ghetto and telling people do not go there. They do not care about Black women or their babies. So for a lot of Black women watching this, it is not just, one random hospital that had a bad day. It feels like confirmation of what they have already heard from friends, family, and reviews, that some hospitals are just not safe places for us, especially when we are vulnerable. And that is the part that hurts, because Black women have been saying this for years. We keep saying they do not believe us when we say we are in pain. They act like we are exaggerating. They label us as loud, difficult, or crazy instead of listening. And the numbers back that up. Because in the United States, Black women have about 50 deaths per 100,000 live births, more than 3 times the rate for white women, and significantly higher than Hispanic and Asian women. Meanwhile, mortality rates for other groups are going down. For Black women, it is still unacceptably high. You cannot separate that from what we just saw in this lobby. When a Black woman in obvious agony is met with a cold face and "I cannot help," that is medical racism in action. Not somebody saying a slur, not somebody screaming at her, just quiet neglect, quiet disbelief, quiet delay. And that quiet delay is how women die. Now, I want to be clear, because that nurse's behavior in that moment is unacceptable, period. If there are professional consequences for her, I do not feel bad about that, because there should be. But I also know she did not learn that attitude in a vacuum. She is operating inside a system that clearly told her paperwork first, protocol first, liability first, the patient can wait. Add in understaffing, burnout, and a long history of racism in medicine, and you end up with exactly this. A Black woman in active labor being treated like she is overreacting instead of like a patient in crisis.
You stretch all the way back, you can see how the medical system has been a part of perpetuating these false beliefs. Drapetomania was actually a disease where slaves would run away and have to be whipped in order to be cured. Individuals still believe that Black patients don't feel as much pain, or that Black patients have thicker skin, or that Black patients have less nerve endings. Just recently, there was a study done, nearly 50% of the respondents to a survey endorsed at least one false belief about Black patients. I think the reason why there's a lack of Black medical students and Black physicians is complex. It's related to history, it's related to resources, it's related to what we have access to right now. I think a lot about what's called the Flexner Report. The Flexner Report was a report that was done in 1910. It was done by the American Medical Association and commissioned Abraham Flexner to go around to all the medical schools in the United States and essentially look at how they were run. What ended up happening was almost all of the schools that trained women were shut down, and almost all the schools that trained minority physicians were also shut down. So what that did was, for more than half a century, you didn't have doctors being trained that were women or minorities. It wasn't until the Civil Rights Act that it required that medical schools actually accept people that were not white.
And if she did get fired, that is a consequence. However, real justice would be a system where a Black woman does not need her mother, a camera, and 30 million views just to be treated like she matters. So for my moms and moms to be watching, if you can, have an advocate with you. Somebody who is not scared to speak up, document, and ask questions when you are in too much pain to argue. Know that in an emergency, hospitals are not supposed to sit you for half an hour in crisis because of intake forms. There are laws that exist so people get stabilized first and bill later. For my healthcare workers who watch this channel, a lot of you are just as disgusted by this as everyone else, and I know many of you are out here doing the right thing in a broken system. But if you ever catch yourself that numb, that detached, that you can look at someone's daughter in this level of pain and feel nothing, you might need to step away from the bedside, because at that point, you are not just tired, you are dangerous. I want to hear from y'all. Have you ever had your pain dismissed in a medical setting? If you work in healthcare, what do you think when you see this clip? And what actually needs to change inside these hospitals? Drop your thoughts in the comments. Keep it respectful, but be real. If you want more conversations like this, where we are not just reacting to the clip, but we are unpacking the systems behind it, go ahead and subscribe, hit the like button, and share this video with somebody who needs to see it. Because as long as things like this are still happening, we are going to keep talking about it. And until the next video, peace, y'all.
So I just saw a video of a black woman who walked into a traditional Chinese medicine hospital in Guangzhou. She wasn't in crisis. She wasn't bleeding out. She just wanted some herbs. She told the doctor her symptoms. And instead of sending her home with a little paper bag, they admit her, like, right there. No ER wait, no insurance interrogation, no proving that she's sick enough to deserve care. They give her a spotless bed, a balcony for fresh air, daily tests, both herbal and Western medicine. And they do it all without hesitation, because the goal is simple: treat the problem and the person before it becomes an emergency. Meanwhile, back here in America, the same exact black woman could walk into a hospital and be told to go home the same day. Because here, healthcare wasn't built to save everybody.